Hello everyone, my name is Gifta Marshanda Hamiseno. I am a student from Faculty of Medicine, Universitas Airlangga, Class of Medical Program 2020. And today we will talk about the axiology and priority list in COVID-19 vaccination in Indonesia. So this is the outline of today's discussion. We will talk about philosophy and science, COVID-19 and its vaccination, further discussion, and conclusion. I'm going to give you a little introduction about philosophy and science. So according to Adib 2015, philosophy is a knowledge that is related to existential meaning, showing that it is strongly related to our daily activities. It is believed that the philosophy is the driving force of our lives as it gives a meaning to what life is. With philosophy, we would consider what is important and what is not, and what is right and wrong before making decisions. The purpose of this is to find the meaning behind the knowledge. Here we will learn more about the relation between distribution of the COVID-19 vaccination and philosophy and science. So there are four pillars of philosophy and science, which covers epistemology, ontology, axiology, and scientific knowledge, or scientific logic. Epistemology is the branch that is related to theory of knowledge and how to obtain it. Coming from the Greek words episteme, which means knowledge, and logos, which means words, thoughts, or opinions, this term means opinions, conversations, and words about knowledge. Ontology focuses on a knowledge that studies a concrete reality critically. Axiology highlights the value of life, which is why it is also known as a theory of value. Lastly, scientific logic is a method to think critically, which is important in scientific research. This paper focuses on the axiological perspective of the COVID-19 vaccine distribution. So as mentioned previously, axiology is known as a theory of value. It is known to highlight the problem in value as well as the usage of knowledge. According to Adib, axiology is divided into ethics and aesthetics. Ethics focuses on what is right and wrong, whereas aesthetics focuses on beauty and art. These two elements fulfill the needs of humans in their lives as it helps us to consider a lot of factors before making decisions. So we will move on to COVID-19 vaccination. So as we all know, COVID-19 is a new communicable disease that is caused by a new variant of coronavirus, which is also known as SARS-CoV-2. And the first ever recorded case was detected in Wuhan, China in December 2019. Right now, there are at least 13 different vaccines that have been administered worldwide. And the first one was a Pfizer vaccine, which was released on 31st December 2020. AstraZeneca comes next, which is on 16th February 2021. And the latest one is released by Sinopharm, which was released by a Chinese company on May 7th, 2021. And we will move on to the discussion, which is on the distribution of the COVID-19 vaccine and the axiological perspective on it. So the COVID-19 vaccine has been distributed in Indonesia since the beginning of 2021. In January 2021, General Secretary of Biofarm told CNN Indonesia that approximately 1.6 million doses of Sinovac vaccine were distributed throughout 34 provinces in Indonesia. DKI Jakarta received the most number of vaccine doses, which reached over 120,000 doses. The next vaccine that is received by the country is AstraZeneca from the COVAX facility. The first batch arrived in the country in March 2021, which reached over 1 million doses. The COVAX facility allocated 11 million doses to Indonesia, which will be delivered throughout March until May 2021. At the beginning of the vaccination development and distribution, Indonesia has made their own priority list for the vaccination. According to WHO, Indonesia is currently prioritizing health workers, frontline workers, elderly, and vulnerable citizens to be vaccinated first. Siti Nadia Tarmizi, Indonesia's COVID-19 vaccination spokesperson, confirmed this via Kompas TV, saying that health workers should be vaccinated first as they are the ones who are in direct contact with the virus. Then the vulnerable group comes next as they need to be protected from the virus immediately. An epidemiologist from Griffith University, Diki Budiman, suggested that citizens who live in DKI Jakarta and nearby should be vaccinated first, as they live in the epicenter of the infection. As per 11th of May 2021, a total of over 13 million Indonesians have received their first dose of COVID-19 vaccine, and under 9 million have received 2 doses. These vaccines are Sinovac and AstraZeneca. Statistically speaking, only 5% of the population have received the full dose of COVID-19 vaccine. This shows that the rate of vaccination is very slow. Johns Hopkins University estimated that Indonesia's rate of vaccination daily is approximately 60,000. If the number of vaccination does not increase, it would take up to 10 years for Indonesia to vaccinate 75% of its population. This is caused by the limited supply of vaccines around the world, as well as the fact that the health system worldwide is still not prepared to face a pandemic like this. From the discussion previously, we can conclude that axiology of philosophy and science can be the basis of the COVID-19 vaccination priority list. As the number of doses available in the country is limited, it is important to prioritize the vulnerable population first. As mentioned earlier, this includes health workers, elderly, and people with coexisting medical conditions. This way, these people can be protected first. This is related to one of the branches of axiology, which is ethics. In this condition, it is right or ethical to prioritize these people first, as they are more likely to get infected by the coronavirus. As the latter population, such as young adults and children, they have less risk of getting infected and spreading the virus further, so they can get vaccinated later after a vulnerable population have been fully vaccinated. So this research has shown that philosophy in science is crucial to research and development in science. It acts as a basis for scientists and researchers before making decisions. This way, scientists would be able to know the meaning behind every research. This is a little reminder for everyone here to always follow the health protocols of COVID-19. You should stay healthy and stay clean. You should always clean and disinfect the things around your house or even your hands, your body. And you should always remember to social distance when you're outside. Stay 5 to 6 feet away from one another. And if you can pick up and deliver stuff instead of buying it in store and meet people directly. Thank you for your attention, and I hope that this video is beneficial for you.